It's time to look at your Medicare Part D plan. I'm Mary Bernhardt, pharmacy technician at Salina Regional Health Center, and I am a certified SHICK Counselor.
Mary, thank you so much for coming on the show. We're going to be talking about the Senior Health Insurance Counseling for Kansas. Why don't you tell us a little bit about that program?
It's a volunteer program. Is for folks that are on Medicare or even considering Medicare. They can get help with answering some of their questions as to, maybe what plans and things like that they want to focus on. One of the pieces is the Medicare Part D, which is the drug plan, and that's the main part that I have been trained on.
Let's talk about the Medicare Part D program that you are familiar with. What all do you talk with the folks about?
Well, when somebody makes an appointment to come in with me, the first thing I do is I make sure that they have a Medicare.gov account, and if they do not, then we'll set that up right away. What that entails is it gets them a logon and a password. I make sure that by the time they leave, they will leave with that information so that they can keep that. And then the next thing we'll do is to look at the drugs that they currently are on. I'll make sure that it's a comprehensive list of what they're on based on the list that they give me. And then we go through and kind of look at some of the different programs, or the different plans that are out there.
What are some of the common mistakes or situations you've seen people get in that you would like to express here?
The most common thing is that people do not check every year to make sure that there were no changes made to their drug plan. So say for instance, they were on a Humana plan, and then they decide, well, I kind of like this plan, it's going just fine. But they may not have contracted with the same companies and the same pharmacies that they did the current year that they're in. And if that's the case, their plan could go, like double or even triple in costs for them. And if you don't check, you don't know that until that first time you go into the pharmacy to pick up your medications, and then you all of a sudden got sticker shock.
If someone wants to get a hold of you and schedule a time, what's the best way for them to do that?
Well, they can contact the CompCare, and that's here locally in Salina, or even, like I said, within this general area if they want to make an appointment with me during open enrollment, which is October the 15th to December the 7th. And we do Monday, Tuesdays, and Thursdays, and that phone number is 823-7470.
For more information on the Senior Health Insurance Counseling for Kansas, you may visit www.kdads.kansas.gov/SHICK. Thank you for watching.